Hi everyone, I'm Dr. Faisel Sayed,
And I'm Dr. Dan McCarter.
and you're listening to Faisel and Friends, where we believe access to primary care is a right, not a privilege.
Today, we're talking to Dr. Wayne Jonas from the Samueli Integrative Health Programs about the promise of whole person care. Let's dive right in.
Hello, Dr. Jonas. How are you doing?
Doing well, and it's a great pleasure to be here and to talk with you and to have some time to talk about how to help healthcare and how to help the population of the country get healthier and improve their well-being.
Well, it's great to see you again and to speak with you. It's been some months. We saw you last time at it was at FMEC in October, and yeah, that was the first time I had gotten out for at least 2 years, like meeting people in person. I would remember I was feeling a little bit of anxiety. I was in Pittsburgh.
Yeah, we've been in a time warp, and it was interesting because we're still sort of half in, half out, aren't we? Hybrid things, sometimes in person, sometimes not. And it's not over yet.
No, that's for sure. Well, Dr. Jonas, I there's a lot of things I want to talk with you about, but first, I would like to hear your story about why you pursued medicine and why family medicine.
So, I'm sort of I don't know, am I old fashioned now? Maybe I'm an old fashioned, dyed in the wool family doc who went into family medicine because of the inspiration and the vision of why it was created, which was to take care of whole people, to take care of people in all their dimensions, the body, the behavior and lifestyle, the mental health, the social and emotional part, and connect it to their lives so that their lives could be better and they could live better lives with meaning and purpose. And to me, that was what family medicine was founded on, the biopsychosocial model, and what my mentors taught me, and I was always inspired and wanted to do that kind of medicine. I had some inspiration from my father, who was a minister. He was actually a chaplain, but he was a hospital chaplain for most of my youth. He was in the military. I ended up going into the military because I saw that was where I could take care of a diversity of people and have the resources and the mindset, the framework to keep them healthy, performing, resilient, etc., which is exactly what I think healthcare should be doing for the rest of the population.
Absolutely.
So I wanted to be doing that. So I did that. I ended up going into both family medicine and then practicing for 20 years in the military in all kinds of settings, hospital settings, intensive care units, and major outpatient settings, as well as being a public health officer. I had to be the public health officer for whole populations, for example. And it was my responsibility not just to treat them, but to keep them healthy in those ways. And so I really learned what healthcare should be like. What does platinum level healthcare delivery look like? But I realized that over the last 40 years that I've been doing this, that the original vision of whole person care has been lost. It's been lost in healthcare delivery in the beginning, and it's been lost in primary care, not because they don't want to do it, but because the system now doesn't let them do it in those areas. So I sort of drifted away from primary care. I got interested in other healing traditions, some of the so-called complementary and alternative ones, which are really what are other healing traditions that have been around thousands of years have been like Chinese medicine, Ayurvedic medicine, herbal medicine. And I got interested in those areas and interested in how did those systems work. And I was fortunate enough to be able to run a research office in the National Institutes of Health, the Office of Alternative Medicine, helped it to become a center for complementary and integrative health, which it is today. And also I ran a WHO traditional medicine center of excellence for several years, where you'd learn about these traditional practices that hadn't lost the holistic view. They had maybe different tools, and maybe they didn't have the science that we needed to do that, but they hadn't lost the mindset and the realization that caring for the whole person was important.
Hmm.
And so I've spent the last 20 years working for the Samueli Foundation to try to both fill in the research gaps and the practice gaps to bring back holistic care. And my hope is that that can return to healthcare, including primary care. And I've written about that in many articles.
Wow. So early on, what would you think? Like, what were some of the causes that you felt when you were practicing that that suddenly you couldn't look after the whole patient, or you felt like you couldn't address whole patient needs?
Well, I think the first wake up call I had is because I was in the military doing all this great whole person care, performance care, prevention, et cetera. And then I looked at trying to get out. I was at a 10-year level, and I said, well, I don't want to make military my career, and so I was looking to get out. And so I joined for a short time a really good family medicine network. And it was really good. It was run by one of my mentors who had come out in the medicine. It was right at the time when HMO and health management, health plans were coming in. And this particular practice, which did embed this philosophy, found itself strangled, if you will, by the payment models. They now had to hire an individual to process the paperwork for every health plan they wanted to make available to their patients. They had multiple funding streams and had to figure out how to patch that together. The administrators of those streams now got into the business of telling them what they could and couldn't do and should and shouldn't do in those areas. And I saw what happened very quickly is that practice began literally to be strangled. They had to reduce their visit times, even though they were a teaching residency program. They actually had to cut those times down, so they had less time to teach residents how to do this. They even took out second mortgages on their house to be able to expand their program temporarily. And I was like, and it was like, yeah, they have the philosophy, but they're not working in an environment that allows them to truly take care of a whole person. And so I said, thank you very much. I don't want to do that. I actually went back into the military and I worked for the Army Surgeon General Office developing a health promotion program. That was really looking at, how do you keep people healthy and what are the underlying determinants and how do you have a system to do that? And so we were in the process of doing that. We had a little Gulf War come along. We were distracted by that for a little bit. A few years later, we had another Gulf War come along and we're distracted by that for a long bit in those areas. And it became hard to sustain those innovations. And I also realized that there needed to be more research data in these areas. And so I ended up going to Walter Reed Army Institute of Research, doing formal research training. Got trained in how to do clinical and basic research. And then I ran and taught research from there for a number of years. I ran something called the Medical Research Fellowship there. And it was from there that I went over to NIH when the Office of Alternative Medicine opened up, because I said, gee, this is opening it up to an even wider set of medical tools. Let's find out what works and what doesn't work and see if we can bring some of those into practice so that we really have a bigger medical bag that every primary care doc knows they need.
Wow, what a story! So, Dr. Jonas, my first question is: so early on, when you were really passionate about looking into what's keeping people, when we talk about improving health, and we generally like to think of improving health as three things: prevention of disease, curing of disease, and when you can't do either, easing of suffering. So when you were looking at, what's keeping people, what's keeping people from, really preventing them getting sick, what were some of the determinants that you initially observed? And have you seen those determinants change? Have you seen some things improve? Have you seen some things get worse?